Hey, sports pharmacist, it's Ashley with the International Sports Pharmacist Network. I am so excited to introduce you to my friend and colleague, John Mobley, PharmD, who is an esports pharmacist. And he's one of the few sports pharmacists that I've gotten to know over time. He's opened up my eyes to the world of esports and how much value pharmacists can bring to the team. Thank you for joining us today, John.
Oh, thank you for having me, Ashley. It's a pleasure, and welcome to everyone as well.
Yeah, I often hear from a lot of pharmacists that they wonder what an esports pharmacist does. And, I give them the kind of brief synopsis of what I've heard from you and what I know from my experience in working with
Mhm.
athletes. But I wanted to talk today about a little bit more in depth about the value that pharmacists bring to the esports athletes and a esports team. And so, I'm familiar with some higher level esports teams having physical therapists, they'll have maybe a team physician, perhaps a nutritionist that they work with. But oftentimes it seems like an oversight that they don't understand the pharmacist value to the team. And so would you mind starting us out by speaking to that and let us know about your experience or what you see as the esports pharmacist value?
Yeah, definitely. I mean, so I think, as you mentioned, like there are a lot of teams, like these large organizations that are starting to recruit like physicians, nutritionists, like saying, a physical therapist even to help out. And I think the area that they're kind of missing with not having a pharmacist on, staff there is kind of like the drug utilization review side of things and understanding, the nuances of medications, right? We look at there's been a shift recently, kind of in esports. Maybe not recently, but definitely a new wave of like supplementation is being used. And those come with a range of complications because when you look at some of these supplements, there's 6, 7, 8 different ingredients in them. And it's like, well, which ones are effective, which ones aren't effective, and at which, concentrations are they effective? And in addition to that, knowing how to personalize it for each athlete, which is, I think, from what I've seen in my experience, nutritionists are great about, getting, dietary intakes for individuals, but rarely are they looking at, blood typing, phenotyping things on a I guess micro level that can also affect performance, right? When you think about, say, for example, caffeine intake, which is a huge thing that happens in this realm of like performance enhancing among esports athletes. I don't know that a lot of them know like the ranges of, maybe safe to toxic levels of caffeine that you would want an athlete to have. Most don't know that, around that 15 micrograms, per milliliter of caffeine is starting to get to those undesirable side effects like tachycardia, tremors, and things that could be detrimental for esport athletes. And so some of those things I think are just missed when you don't have a pharmacist on staff that can be like, hey, maybe this supplement or maybe this thing is too much or too detrimental for an esport athlete. Beyond that too, as actually recently within like last 2 weeks, heard there was an esport athlete who was suffering with some unilateral kind of nerve pain and stuff, and the doctor decided to put him on gabapentin. Wasn't a team doctor, mind you, but it was just their PCP had done it, and it's like I don't know that gabapentin, and they started having some undesirable side effects from the gabapentin. And it's like, I don't know that that's, medication you need to be on for unilateral, it's also like, well, what hand is it in? Is it in your mouse dominant hand? People tend to drag that across the desk a lot more. And so we turned to find out that a lot of it was just the positioning of his hand and the angle which he was playing with. And so a lot of these medications we can also knock off from some of these athletes or just be cognizant of the interactions they have because they're taking them more often, more frequently, or in indications that aren't maybe like a primary indication for the medication. So I think that's the value that a lot of pharmacists can add for the esports field.
Yeah, I feel like that's a great example. And that's one thing that you opened my eyes up to in some of our discussions about how do we provide better clinical care as pharmacists to these athletes, because recognizing when it is actually more of an overuse injury and something that we need to actually discuss with the athlete taking time away as opposed to or changing their training schedule, or maybe looking at fewer competitions if it's that bad of a overuse injury. But talking to them about when medications are appropriate, and especially highlighting those side effects. I feel like that's a lot of what I do is deprescribing either talking about weaning off of, medications, but also, as you were mentioning, avoiding dietary supplements. And, you mentioned some great examples there, but would you mind going a little bit more into just the type of self-care that you've helped address with some esports athletes, and how you've made an impact in some athletes' careers and when it comes to self-care?
Yeah, definitely. So two things I should, or maybe two distinctions that should be made is one, I think it's also important to know when you're dealing with an athlete, their background, right? Especially when it comes to esports, because you have what I would maybe what I would call like cross athletes. So people who've done traditional sports who are, physically in different shapes and are probably going to have a little bit different background as far as supplementation, medication usage than maybe first time athletes that are just getting into esports. And so I think that distinction is important because when I'm dealing with like a cross athlete, so say someone who played football, basketball, tennis, golf, really any physical sport, and are coming into esports, the big thing is understanding like what you could tolerate at that level is slightly different, right? When we look at like caffeine intake, when you are taking caffeine and then running, or say doing cross country or biking or cycling, some long-term endurance, right? Your body is going to process that caffeine differently than if you're sitting at a desk doing micro movements, for 4 to 6 hours a day, right? And we also have to look at, the length of time of activity, right? Cross country, you're running 2 to 3 hours. And although it's very intense running for 2 to 3 hours, right? When you're done, right? For, a typical esports training day is depending on the level and stuff, but if we're looking at like, professional levels, right? Or those higher levels, or even semi-pro, you're looking at they're up by 8 or 9. They usually do like a morning workout, breakfast, 2 to 3 hours of training, and somewhere there's like an hour of film review, and then they have another 2 to 3 hours of solo or like individual play, and 2 to 3 hours of team play. Day's usually over. So when you're thinking about that, you have to be mentally active and with intense focus and concentration for probably anywhere from 6 to 9 hours out of the day. It's a little bit different than a typical physical sport. And so, in those individuals, we're looking at making sure that supplementation isn't, what's the word I want to say? I won't say bad, but for lack of a better word, they're not using bad supplements, they're not using unregulated supplements, and they're not overusing supplementation. When I look over to athletes who are maybe more first-time athletes getting into esports, right? The issue there is like you're saying, like overuse, right? If you're playing for 6 to 8 hours a day, your fingers, your wrist, your shoulders are going to be exhausted. And additionally, you're going to start having GI issues. You're sitting for long periods of time. If you're not smart enough, as I mentioned, with the pro athletes, they're working out in the morning. Usually they sometimes even have like a light workout or some kind of cardio in the evening, depending on, how intense they are and what sport they're in too. Most individuals aren't doing that. So they're getting up, they're eating breakfast, then they're sitting down immediately after. And so you start looking at GI motility issues in those individuals. You start looking at overuse injuries in those individuals. And then also you start looking at some of the side effects because of medications aren't processing through their body the same way as it would, like an athlete. And definitely in the amateur scene, right? And then those people are first starting off, because they don't have those nutritionists and dietitians and things, their nutrition is so bad that the medications they are taking aren't also processed in the way that they should. So I think that's a big area that just when you're clinically looking at an esport athlete, it's like, well, where are you coming from? And then understanding where in this I guess process are you? Are you someone who's maybe overutilizing some supplementations because you're acting as if it's a still physical sport, or you have no knowledge of sport background, but then you're underutilizing and overexerting yourself because you just don't know.
Right. Yeah. And that's one area that I've definitely been doing more research and trying to improve my understanding is obviously there's the cognitive side that these esports athletes are trying to work towards their highest potential with the cognitive side while they're, using more fine motor skills. And that's very different than the athlete who is working towards their highest level of athletic physical performance. And so adjusting, medications where they need to be adjusted for whether or not it's impairing their cognitive ability or their judgment or, their executive functioning. Those are obviously the side effects that we consider of medications a lot of the times with, whether or not it's affecting their CNS. or something
Right.
like that. So so you mentioned also about, the increased use of dietary supplements. And I have
Mhm.
seen within the gamer community that gamers themselves are sometimes developing formulas and marketing them to their peers. And I'm under the impression, and any listener can correct me if I'm wrong, but a lot of these formulations that are being concocted are not necessarily based on evidence, first of all, but they're also being put together by gamers who might not have any medical background, let alone a pharmaceutical education. And so, but at the same time, the popularity has just exploded when it comes to nootropics. And as pharmacists know, there's very little regulation on dietary supplements, and they're a high risk for our athletes to use. And I wanted to just get your opinion, John, about, do you think that some of this explosion has happened in relation to the relatively recent disclosure that Adderall was being overused and misused by esports athletes? And I just wanted to, talk about that aspect, because I hope that Adderall use has gone down among the esports athletes community. But at the same time, what is your opinion about nootropics, and what scientific evidence have you found so far about nootropics?
Yeah, I mean that's a great question. So I mean, as far as Adderall usage, it is this is always from I think its initial discovery in esports been a problem. Is there less attention on it now? Yes, and I think hopefully, and just from my professional and personal experience, I think that's some of that is there is just a decrease in the community using it, right? Now, has that kind of caused this like rebound effect where now people are trying to find a replacement for it? Absolutely. And I think that's what's fed into this whole nootropic market. It's like it just kind of exploded. Before esports, really nootropics were only looking at, um, you know, people with like dementia, Alzheimer's, kind of that population where we're trying to, slow the deterioration of cognitive function. And I think now because esports is such a cognitively intensive field, it has kind of just been this massive shift into it. And what I always tell, athletes that I work with is that, it's really a very kind of wild west right now when it comes to nootropics, right? Most companies are not, adhering to like good manufacturing practices, which means on any given pill, bottle, a supplementation from week to week, month to month, you don't know that you're getting the same medicate or the same supplementation every single time, and you don't know that it's safe and that there's not lead, cadmium, and other just harmful things that are being included in these supplements as well. In addition, like you mentioned, some nootropics claim that like, oh, we have MDs that have reviewed it, and although there is I think, benefit to that, that doesn't mean that it is completely safe, right? An MD reviewing it versus a pharmacist, nutritionist, and other people, it's you're going to get a different perspective on those supplementations, and a lot of them slap an MD's name on it, but it's like we just went and looked up, the top 10 nootropics we've heard that aren't controlled or regulated, which is another concern. We threw them into a pill, should work, right? Very little insight into interactions, safety, and efficacy on those things. And even when you look at studies, it is one of two things that I have found. It's either that there's a bunch of studies to say that are I would say maybe well-structured studies that say like, hey, it works, but there's an equally amount of studies that say there's just no compared to it's um, not a necessarily placebo, but compared to like a I don't want to say standard of care because there aren't really many standards of care in this environment, but compared to a competitor, right? There's just no difference, and so the evidence is very divided, or it's the abundance of evidence is just like maybe it works, maybe it doesn't. And so I tend to tell people to try to avoid those things because it's just you don't know the safety and efficacy of it, right? Sure, caffeine. Some people, use ginseng and other stuff like that. Are there? Um, is it the evidence to suggest that that works? Sure, but again, it gets to that point of like, at what point though is it being harmful? And like how much should you be intaking? Because especially with caffeine is I talk about caffeine way more than I care to admit in this thing because I think that's kind of like the miracle substance that people think it's like, oh, if I'm having a rough day. Because also again, dividing the two, when you talk about people who are kind of first getting into esports, most of them, working college students, so they have something else if there's primary function in esports is kind of like a close second. They use caffeine to overcome, kind of that midday slump or to kind of increase performance and stuff. But what they don't realize is when you have all these supplementations that are coming from different places and there's a lot of caffeine you're taking in, right? If you're drinking soda, you're getting caffeine. You're drinking Red Bull, you're getting caffeine. You're taking a lot of these dietary supplements, you're getting caffeine. There's just so much caffeine that they're intaking that sometimes they don't realize how much they're getting.
Yeah.
I tend to tell people to try to avoid supplements for the time being because there's just not a lot of regulation over it right now. And like you're saying, a lot of it is just kind of ooh, hey, this streamer or this player uses a supplement. Yeah, but they maybe used it for a month and they were like, yeah, I'm good. Or hey, they're sponsored by it, so they'll say they use it. It's not always healthy. And there's an abundance of, I think, just use examples out there where there's streamers who use the medication, had a bad side effect, and they're like, I don't use it anymore. Some of them have suffered pretty disastrous side effects as well. And it's something that I think people should be very cognizant of and what they're doing and check with a pharmacist to know if it's safe before using it.
Yeah, exactly. I mean, there's, as you mentioned, caffeine is a huge part of every discussion when it comes to any kind of stimulant use, whether it be from your energy drinks or the dietary supplements or, other food intake. And when we're combining the neutropes that have little evidence and we don't really know how those chemicals truly act with the other stimulants that are in a product, as you mentioned, it can lead to some pretty bad side effects. And, also, I think that all pharmacists are already familiar with it, but just the reminder that there should be no supplements that ever make any claims to treat or cure conditions. And I see that a lot with nootropics. They're, suggesting that they can treat certain conditions. So, those are red flags. There's some great materials out there for how we can assess dietary supplements and their risks for athletes. And I'll put some links down below instead of discussing them today. But for our last question, John, if you wouldn't mind telling us what you see as the future of esports pharmacy.
Yeah, that would be all. Yeah, so that's oh man, I don't know how much time you have about that, but so I think there's kind of like there's 2 or 3 areas that I would love to see esports pharmacy grow in, and I mean I'm not I guess a future teller, but I'll try to say what I think is kind of the area that might be most prevalent now. So one, like I was mentioning earlier, like drug utilization review, it's a big part that I think is just under, and it's one of those things that can happen even on the back end, right? You don't always have to be on the front line with teams, although it would be nice, but it is something that can offer, as far as like a clinical and therapeutic review for athletes to be like, hey, what are you taking? And, with that, even adding in kind of blood work and pulling labs for that to be like, what are you taking and what actually effect is it having in your body? How much of it is making it into your body? How much of it is being absorbed? How much of it is being utilized? And is it even affecting your performance? Because like you mentioned, a lot of these nootropics will be like, oh, increased focus, better performance, better mental clarity. There's no evidence to show that those assertions are true. And they really shouldn't be marketing them as true because they're just non-existent, right? And so that's an area I think as far as just, not only just from a safety standpoint of making sure and safety and efficacy standpoint the pharmacist can offer, but even from an important from performance words enhancing perspective, pharmacists can be there to be like, this isn't going to benefit, this isn't going to help, right? I haven't heard of, and I pray that it doesn't happen, but I know beta blockers are used sometimes in traditional sports. I haven't heard of that being used in esports yet, and I pray that doesn't become a thing. But those are just issues in the areas of study that it's like pharmacists can definitely be on the front line and saying like this should not be allowed. And this shouldn't be allowed from a safety standpoint, and this shouldn't be allowed from a performance enhancing standpoint. So I think that's one area that the pharmacists can, and the future of esports pharmacy. The second one kind of piggybacks on that in the sense that there's not a lot of regulation right now around supplementation and medication usage in esports, right? As you mentioned, there is a lack of I don't say clarity on the topic, but there's not much there's a lot of code, right? There's not much of that for esports. There's nothing like the Adderall usage that you mentioned. When it happened, everybody was kind of like, ooh, we should probably stop this. but there was no major league. There was a few like CS:GO leagues, but there wasn't like an overarching across all esports where they're like no Adderall usage, right? And although some places say, oh, we would prefer that not to happen, there wasn't really like code to say like if you test positive, you're or not disbanded, but you'll be sanctioned, right? And a lot of these esports leagues just don't have any sort of prohibited list, and so I think that is a big area for esports pharmacy that can progress is producing these prohibited lists that are going to be slightly different because of the nature of the sports. You can adapt most of the prohibited lists from other physical sports, but there's probably going to be certain supplementation and things that also have to be added in there. And so that's an area from like a regulatory standpoint of esports pharmacy that I think can definitely progress. And then third area would definitely be in that supplementation perspective where it's like, can we produce supplements that are safe, that are produced according to GMPs and are effective, that can be used as supplementation for athletes? Beyond that, can we also produce medications that maybe aren't even performance related, but when we're looking at overuse disorders, like do we need to produce like creams or ointments or NSAID based products that might be good for athletes who tend to have inflammation around their wrist and stuff because of overuse? And like, can we produce excuse me, different supplementation to help with like dietary constraints? And because I know one big thing that's happening in a lot of esports, and some of that's with emerging media trends and stuff like TikTok. I pray every time I hear an esport athlete that says they've seen something on TikTok, I'm like, time out. Like let's consider where it's coming from, right? But when you think about TikTok, even Instagram sometimes, and all these influencers that are pushing products, it's like, what is the purpose of this product? Some of them are like, oh, are you not getting enough, vitamin or not vitamins, vegetables or fruits? Take this pill and that'll solve the problem, right? That's another area where it's like I really think esports pharmacy can progress in that, because there are supplementations that you can produce in those things that can help supplement maybe a non-traditional diet that a lot of these esport athletes are suffering from, that can help them, but do it in a safe and effective manner. So
Yeah.
Those are probably the three areas, I guess, as far as like regulation with producing prohibited codes, safe supplementation production, and then clinical reviews are probably the three areas I see esports pharmacy growing in the future.
Yeah.
The one I'm most excited for is probably that supplementation side. I think supplementation on good and bad is like the biggest cash cow right now in the esports market. It's probably where the most money is poured in outside of pro level athletes. When you look at the average esport player, a lot of it, their money, their disposable income that they're using on these things are going into supplementation, and it's not safe, it's not effective, and it's not regulated. So I think that's probably going to be the biggest area of growth for esports pharmacy in the coming years.
Yeah, I'm a huge advocate of the food first approach, and let's fix your diet and get you connected with the right nutrition dietitian or nutritionist who can actually help benefit from doing foods first. And I'll still hear athletes push back and say, well, I'm just not going to eat the amount of foods that I need to get that benefit, and I need a dietary supplement. And then when they're actually looking at a dietary supplement, they're not actually getting the recommended amounts for a treatment if they actually need a treatment. So I agree with all of those areas. I think that reflects well what pharmacists are doing with other athletes, and the way we're moving forward in proving the pharmacist value to the athletes. Once athletes work with pharmacists, then they're like, oh, that was really helpful. Those are the small changes that I needed to make in order to make some improvement in my my career as an athlete. So great. And I really appreciate your time today. And I'm
pleasure.
sure that we'll have a lot of more things to talk about in the future. And I hope that anybody who has questions will drop them in the comments down below, and we can follow up with you, and you can find more information at sportspharmacist.org. Thank you so much for your time today, Jonathan.
Oh, it's my pleasure. Thank you for having me, Ashley. Have a great day.
All right, I'll talk to you later.